Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about variations in erythrocyte size and color. Normocyte is a normal and mature erythrocyte with a diameter about 7.5 micrometers and mean cell volume within the reference interval of 80 to 100 femtoliters. The majority of normal erythrocytes are disciform in shape. On a stained peripheral blood smear, they are approximately circular in outline and show only minor variations in shape and size. Normal erythrocytes are approximately the same size as the nucleus of a small lymphocyte. Microcyte is a small erythrocyte with reduced diameter to less than 7 to 7.2 micrometers. Microcytosis may be general or there may be a population of small red cells. If all or most of the red cells are small, there is a reduction in the MCV, but a small population of microcytes can be present without the MCV falling below the reference interval. Microcytes are often associated with iron deficiency anemia, thalassemia minor, anemia of chronic disease, sideroblastic anemia, and some hemoglobinopathies. Macrocyte is a large erythrocyte with increased in size and diameter on stained peripheral blood smear. Macrocytes may be round or oval in outline. Macrocytosis may be a generalized change, in which case the MCV will be raised, or it may affect only a proportion of the red cells. Macrocytes are often associated with liver disease, vitamin B12 deficiency, folate deficiency, and reticulocytosis. The erythrocytes of neonates show a considerable degree of macrocytosis if they are assessed in relation to those of adults. A slight degree of macrocytosis is also seen as a physiological feature of pregnancy and in older adults. The peripheral blood smear shows macrocytes and polychromatophilic erythrocytes in a 54-year-old man with reticulocytes of 6.3%. Anisocytosis is the variation in erythrocyte size and diameter, and is a common, non-specific abnormality in hematological disorders. In automated instrument counts, an increase in the red cell distribution width is indicative of anisocytosis. An RDW greater than 14.5% indicates a heterogeneous population and a variety of sizes of erythrocytes. Anisocytosis is associated with anemias, especially iron deficiency, megaloblastic, and hemolytic anemias. Normochromic describes a stained erythrocyte with normal color and normal hemoglobin content with a mean cell hemoglobin concentration within the reference interval. Hyperchromia is abnormal decrease in the hemoglobin content of erythrocytes. Hyperchromic erythrocytes appear pale with a larger central pallor. Hyperchromia may be general or there may be a population of hyperchromic cells. Any of the conditions leading to microcytosis may also cause hyperchromia, although in some subjects with alpha or beta thalassemia trait, the blood smear shows microcytosis without appreciable hyperchromia. Hyperchromia is usually associated with iron deficiency anemia, thalassemias, sideroblastic anemia, and some cases of anemia of chronic inflammation. Anisochromasia describes an increased variability in the degree of staining or hemoglobinization of the erythrocytes. In practice, it usually means that there is a spectrum of staining from hyperchromic to normochromic. Anisochromasia commonly indicates a changing situation, such as iron deficiency developing or responding to treatment. Anisochromasia is reflected in an elevated hemoglobin distribution width measured by some automated instruments. Dimorphism indicates the presence of two distinct populations of erythrocytes, which differ in their size, hemoglobin content, or shape. Dimorphism is most often applied when there is one population of hyperchromic, microcytic cells and another population of normochromic cells, the latter being either normocytic or macrocytic. Polychromasia or polychromatophilia describes erythrocytes that are pinkish blue as a consequence of uptake both of eosin, by hemoglobin, and of basic dyes, by residual RNA. Polychromasia usually is associated with acute and chronic hemorrhage, hemolysis, effective treatment for anemia, and in neonates. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.